Yes, thank you very much, Bram. So first of all, I fully agree with Bram. So if you are here and you are a child, please go to the physical activity room instead of here. That's because I am really encouraging people to be physically active and to do exercise. So my background is that I'm a researcher. I'm working at the Rehabilitation Medicine Department in Amsterdam UMC. My background is in exercise physiology. So today I'm going to present about the topic of exercise. And a first important thing to mention is that we see a diversity of different neuromuscular diseases in Amsterdam. Amongst them are muscular dystrophies, not particularly, which is also the first disclaimer I have today. So I'm going to present on exercise. It's good to know that so far, as far as I know, and I'm quite well informed, there haven't been any studies on exercise specifically for LAMA2 patients. So first of all, to start off with, it's important to know that there is so I'm going to speak about exercise, and there is a difference between physical activity and exercise. Actually, exercise is a form of physical activity, the aim of trying to improve someone's... Maybe I can better start. Probably this is better. So the idea is really that you try to improve, or in some cases maintenance is also improvement, is that you try to improve or maintain the physical fitness. And physical fitness can be, for instance, endurance, but it can also be muscle strength. The previous speaker was talking about stretching exercises, which is good for flexibility, which is also a part of your physical fitness. So just let me give an example. So if you go to the swimming pool once in a while, this is what we call physical activity. But if you do it 3 times a week, and your goal is to maintain or to improve your endurance, then we call it exercise. So it's good to know that today I'm going to speak about exercise. And why do we think that it may be important for people with neuromuscular diseases and also people with LAMA2, is that we know that the physical symptoms being common among muscle diseases, such as muscle weakness, fatigue, and pain, they all lead to physical inactivity, and that again leads to what we call deconditioning, which is a reduced physical fitness. And that again leads to a worsening of symptoms. So there is kind of a circle of inactivity, and what you try to do with exercise is to really break through this circle. So what you try to do is you try to improve the physical fitness level and thereby breaking through this cycle. So what do we know about physical fitness in muscle diseases? So it is a thing that you can measure. So what you can do is you can do what we call an exercise test. You see an example here of a patient with a muscle disease on a bicycle ergometer. In the Netherlands we like to cycle. But you can do it with any form of ergometer that you have. So you can also do it with an arm ergometer. There are also equipment where you can use both the leg and the arms. And the idea is that you're going to do an exercise test where the intensity is going to be built up until someone can no longer keep a certain pedaling frequency. And meanwhile, you see this mask, you can actually measure the gases, and you may know that oxygen is a very important one for us, because actually oxygen is needed for the muscles to generate energy in order to be able to move. So you can measure the peak, what we call peak VO2, so it's the peak oxygen uptake. And it is a very important marker for health. But we also know that it is a very important marker in terms of functioning. Because there is a certain threshold of which we know if you are below that threshold that people become more dependent. And I don't want you to focus on specifically on this number, but know that there is a threshold here. And the other thing is that we also have data from different muscle diseases. And basically what we see is that all of them are around this line. So that means that they are all around this threshold for being dependent or independent. That also means that if you only improve your physical fitness level a little, that could already be very helpful. So what about exercise for muscle diseases? So basically we have come a very long way. So the question that was asked by one of the parents of a child was, my child is very enthusiastic about being active in sports. And I hear different sounds. So, and this is what I also recognize from other muscle diseases. So of course there is the fear of, do I do my muscles more harm than it may be beneficial for me? And this has been the idea for a very long time, and it's only since the last 3 decades that there has been more and more research showing that on the one hand exercise is not only safe, but it's also beneficial for people with muscle diseases. And that's for a whole spectrum of muscle diseases. So nowadays what we see, and this is actually the report, so of last year, 2 years ago, I brought together a international working group. And this is actually where we, for the first time, fully reached full consensus that we should actually encourage people with muscle diseases to be engaged in exercise. So that's a very important step. So this is informed by scientific research. Like I said, I'm not going to go into too much details, but in the meantime, we have been able to do some literature researches. So you bring together all the literature that is there and you try to answer a question. In this case, is exercise safe and beneficial? And we do have enough evidence now to say that that is actually the case. But what I want you to focus now is on the right side of the screen, because that makes it a bit more practical. Is that whenever your healthcare professional is going to prescribe exercise, they usually make use of this, what they call FIT principle. And FIT stands for the F, which is the frequency. So how many times a week should I do exercises? The I is for the intensity. So at which intensity should I do it? The first T is for the time. So how long should an exercise session be? And the last T is for the type of exercise. So which type of exercise should I do? And what you see here is just an overview of what we found in literature. So in general, what we see is 3 times a week. And then the intensity is at, you can say, a certain percentage of someone's maximal capacity. The time is between 20 and 40 minutes per exercise session. And the duration of the programs we found was between 6 and 26 weeks, so up to, let's say, 6 months. And mostly the cycloergometer was used, and that's also because we know that when people cycle, they don't have the issue, for instance, of balance when you compare it, for instance, to walking. So cycling is very often used. So this was actually for yesterday's presentation. I'm just going to highlight one thing here. So this is an example of studies that have been done in different muscle diseases. They're called Becker and limb girdle muscular dystrophy. So they are also muscular dystrophies. And what I wanted to show you with this is, so there have been done the aerobic exercise is also known as endurance exercise. So that's really mean to improve your endurance. And you also see an example of resistance exercise, which is aimed at improving muscle function. And for now, I'm going to focus on the endurance exercise program. So there is some things that I want to highlight. So the first thing you see here on this axis, you see the physical fitness level. And in this case, again, it's the peak VO2 that I just mentioned, the oxygen uptake. And on the x-axis, you see this is the assessment right before the exercise program, and this is right after. And the black lines are actually the people, in this case, with Becker muscular dystrophy. So the first thing that stands out is their physical fitness level is lower as compared to the healthy controls, who are the dotted lines, which makes sense. The other thing, what we also see is that there is an increase in physical fitness when people do an exercise program. And the last thing, which is very important, is that the response is more or less similar to what we see in healthy people. So this is very important information. Then another example, and this is work that has been done recently by my colleague Tanya Teufelsalo from the US. This is very recent work. So in Duchenne muscular dystrophy, which is also often occurring at a very young age, and has similar questions to the ones that are here for LAMA2 in terms of should I do exercise or not? And for a long time this has not been studied because of this fear. And I'm really glad that my colleague took the initiative. So to give you an idea, so this boy is doing two kind of exercise programs. So the first part of the program, the first 12 weeks was focused on endurance exercise. And you see this boy doing endurance exercises, and this is actually a motor assisted equipment. But that doesn't really matter, because what you try to do during the exercises, and that is what you see in your FIT principle, is you try to train at a certain heart rate. So what you can do is you can just start at a certain resistance level or a certain like I said, assistance level, and it can be high in the beginning, as long as you make sure that the heart rate is at the intensity zones where you would like to have it. And then meanwhile, what you will notice is that the body adapts to training, and that means that you can just lower the resistance. So that is what they did, and they also did some resistance exercises. The only thing they made sure is that they avoid what they call eccentric exercises. Eccentric exercises is a form of exercise where the muscle is actually lengthening while we're doing exercise, and a very good example is if we walk down the stairs here. That's an example of where there is very much eccentric exercises. So those are the ones that we really still recommend to avoid in Duchenne, and I would do the same for LAMA2. So having said that, there are some interesting outcomes here as well. So first one being, again, the physical fitness. So also here we see an improvement. So this was done in, I think, 6 boys with Duchenne. What we also see is on the left bottom, this is a marker that is used quite often for muscle damage. And the most important thing to see is that at least there is not an increase when you do an exercise program. It even shows here a slight decrease, but the most important thing is that it is not increasing, because that would give you a signal that there might be muscle damage. We also see that actually the muscle mass in this case is increasing. And we also see that the effects are not only there for physical fitness, but it's also broader than that. So in this case, they also found, for instance, improved inflammation markers. So we do know that in the meantime, that exercise can be done safely in people with muscle diseases and that it has beneficial effects. So the other question is, how is it currently applied? And what I'm showing here is the data of a survey that we did. And the survey was part of the workshop that I just mentioned. And these are actually the survey results of the healthcare professionals, but we also asked people with muscle diseases themselves. So we had over 2,000 respondents, which is quite a large group. Well, basically the results we saw there were quite similar to the ones you see here. So what we saw was that most of the people reported that they actually were doing some kind of exercise. And I think one disclaimer is, if you do such a survey, then probably the people who are more interested in the topic will respond more. So I think it's actually slightly overestimated, but at least the good news is most of the people that responded said that they were doing exercises. And same as for the barriers we see here. So some of the barriers that the patients were mentioning were also related to safety issues. And another important one was the lack of knowledge of healthcare professionals. We found out that, on the other hand, a facilitator is being able to speak with a knowledgeable healthcare professional who can really help you, for instance, also with designing and prescribing exercise. So where it says here that the healthcare professional needs guidance, it's basically the same for patients, but of course they don't need it in terms of specific recommendations, but they rather have a healthcare professional who is knowledgeable and who can actually help them. So when it comes to recommendations, so these are slightly different. So I'm going to mention these, and then in addition some of the ones that the patients mentioned. So the first one is very important. So exercise should be personalized. And one thing you can do is at the beginning, when you consider to do exercise, is as a healthcare professional, but also for you as a patient or a parent, is to speak with your healthcare professional about the personal goals. Because what I'm telling you today is that exercise is good for physical fitness, but we also know from previous surveys that the reason why people consider to do exercise, they actually differ. So we found out that for adults, they actually say, I'm going to exercise because it's good for my health and my fitness. But we also hear it for children with other muscle diseases, that they do it for fun. So it's very important to start thinking of what are the goals of you to do such an exercise program. It's really important because your motivation, and that's one of the largest barriers. It's also for people without any diseases. It's really going to help with your motivation to continue the exercise program. So supervision was also mentioned by Alberto in the previous talk. I also want to stress that. So especially during the early stages of the exercise program, make sure that there is supervision to make sure that the exercises that you are doing, that they are done in the right way, but also at the right intensity level. That's really important, and I think later when you become more familiar with doing the exercises, I think you can actually reduce the supervision level. So particularly in the early stages, this is really important. There are some tools that you can help when it comes to monitoring the training program. And monitoring is another issue, which is very important, but we also see in studies that it is not done so well. And I think it has to do with the fact that people don't really see why it is important. So what we usually do is we ask people with muscle diseases to keep some kind of a diary or a logbook. And in there you can, for instance, indicate how heavy was this training session. Do I have any physical complaints in terms of muscle soreness or maybe more fatigue than normal? So it's really important to report things that are beyond what is normal. So people with muscle diseases, often they are fatigued, but in this case the question is, after an exercise, am I extremely more fatigued than normal? So it is important to not only monitor the training load, and the advice would be to rather start at lower intensity levels and then build it up, rather than starting at higher intensity levels. So that's very important. A very easy tool you can use is what is called the Borg scale. So you can just ask someone during or after the exercise, okay, how hard was this for you? And there are different skills. This is the one from 1 to 10. There's also one from 6 to 20. There's different skills in use. And like I said, monitoring recovery is also very important. So for you as a patient, I think it's important that you can also tell your healthcare professional that there are some resources that they can find. So this is an example where the outcomes of the workshop that we organized are presented. And I think the good thing is that there is also a translation in lay languages, and that's actually available in different languages. So with that, I'm going to end this presentation. So coming back to the question. So the question of the parent of the child was, should my child do sports because he likes to do it? My answer would be yes. I would definitely encourage to do it. But please make sure, especially in the beginning, that there is some close supervision to find out really the personal goals, the motivation, but also that exercise is done in the right way and a safe way. And with that, I would like to end the presentation, and I'm happy to take any questions.
Thank you very much, Erik, and sorry for the mix-up of the presentations, of course. We're happy to answer some questions. There's also a question in the chat, but Anna will take care of it.
Thank you very much. And just I would like quickly to start with a question from the chat, asking if you could recommend exercise for a LAMA2 patient who has never walked and who can't sit still.
Sorry, can you repeat?
Who has never walked and who can't sit still. Patient who can basically just sit with support.
Yeah, so if I understand well, the question here is someone can only sit?
Yeah, and what would you recommend in that case?
Yeah, so it's good. So I'm not gonna talk about specific exercises because I think that's really the work of the physiotherapist. But like I said, as the example with the exercise testing, I mean, there is many different forms of exercises that you can do. I just saw a great example in the playground where the children were playing with balloons in wheelchairs. I would be very much interested in knowing the physiological response. I think it actually increases the heart rate to a certain amount. So just to give an idea of that, it's really position work, and I'm convinced that physiotherapists and also sports therapists, for instance, they are the experts that can come up with exercises for them.
Thank you. I think, is there any questions? Yes, there was a question from there. In the meantime, can I, yeah. Quite a lot of questions in the.
Hello. I have a question about the electrostimulation.
And probably your question is, should I use electrostimulation?
Absolutely.
Yeah, so there is what they call functional electrical stimulation.
On lower hertz.
Yeah, so the idea is that you externally stimulate the muscles in order to, well, help the muscles. There have only been done limited studies in muscle diseases. There are no clear indications that it's going to be helpful for what I was speaking about, physical fitness levels. So it's probably not going to increase the muscle strength. I don't know anything about the safety. I know that is also being used in, for instance, in spinal cord injury, but there it is more directed, for instance, at well, preventing wounds that they have due to inactivity. So from the perspective of physical fitness, I don't see any indications for beneficial effects yet.
There's another question from the chat, and they say the doctor recommended not to perform repetitive exercise because the damage inside the muscles is irreversible. Is there a recommendation on the resistance of the exercise to not damage the muscle?
Yeah, so this is basically what I hear all the time. I understand the concern, because the question here again is, do I harm the muscles more than it benefits them? So far, the evidence is saying the opposite. So also for people with muscle disease, and like I said, we don't have any evidence yet for LAMA2, but I think, I mean, it has been done now for such a whole spectrum of muscle diseases, all showing the same, that my recommendation would definitely be to encourage it.
Okay, can we have time for another question before we go to the next? Okay.
Can you recommend the balance between the regular therapy and aquatherapy?
Sorry, the balance between?
Aquatherapy?
Yeah.
So how, like I saw, 2-3 times per week, you recommend the exercise?
Yeah, well, like I said, there are different forms of exercise. I know that hydrotherapy has also been studied. I think, like I said, I think I would recommend to start at low to moderate intensities there, and you can. I mean, it's difficult to measure your heart rate in the swimming pool, so maybe you can use the more easy tools like the ones I showed, rating of perceived exertion, and then just make sure that you keep below a certain level, like from. In this case, from 5, it says, okay, this is hard. So I would definitely try to make sure that you at least start below that level. And I think in terms of the frequency, I think that's also what, it starts with what people can do, of course. I mean, yeah.
Thank you. I think we might have to go ahead. And for further questions probably can be asked this afternoon. There will be round tables, so
yeah.
I'm sure that we can talk with Eric this afternoon. So please, and also for the people in the chat, there is another question, so we can definitely pass this to Erica.